If you prefer a bulk fill material, then a glass hybrid restorative material is really the best choice for you, because we'll talk in a little while about the different materials, but the material I previously mentioned is a resin modified glass ionomer. So again, be respectful of the IFU, the instructions for use, and it really needs to be placed in 2mm increments. For most of my high-risk patients, I opt for glass hybrid restorative technology. This was a case that I treated with EQUIA Forte as a restorative material. It's got a great bond strength to dentin and cementum. It forms strong chemical and the dynamic bonds I mentioned to you earlier with underlying tooth structure. This material also has the ability to remineralize carious tooth structure, and a lot of research from the University of California in San Francisco is proposing a conservative, not even a complete caries removal when restoring teeth with a glass hybrid restorative material. Now, you see a patient like this who comes in, and you can see here that this is a high-risk patient. This is somebody who has active caries. And so this is how she looked, and this was actually a number of years ago, and she still looks this good. These materials hold up beautifully, especially if you can control the environment in which that tooth is in. I also particularly love glass hybrid restoratives in areas where isolation of the tooth is near impossible. I had to replace this amalgam, as you can see, I could barely get a photo of it, around the distal of tooth number 2. I prepared the area, and I was concerned that I might not have enough retention for an amalgam. Also, I wasn't sure if I was going to have the access to properly condense an amalgam here. And if I was considering a composite, I was also really concerned that I couldn't isolate this area properly for a composite. So I really believe in this area, my only viable option is a glass hybrid restorative. And this material's still hanging in there, and it's been about 3 years on this patient. So I love seeing him, and I love seeing that it's still holding up. I also feel that I owe it to you guys, especially if you've gone to or listened to my webinars in the past. I have to give some updates on some cases that I've previously presented. So this is a case where I used a glass hybrid restorative material to restore a fractured area on tooth number 2, where the tooth was symptomatic when biting. Now, I'm sure I know what you're thinking. You're thinking, why wouldn't you consider a different treatment option for this tooth? I know. However, this is a non-traditional treatment on a very non-traditional dentist, and my only option with him was a direct restoration with a glass ionomer-based restorative material. So I prepared the tooth beyond the crack. Normally with these materials I would use a sectional matrix, but obviously this was a lot larger restoration, and I restored this tooth with a glass hybrid restorative material. Now I can tell you that this has held up really well, and it's still hanging in there, and we're at about almost 3.5 years at this point. So I'm really happy that it's been there. Now I will also say that you might say, hey, you've been telling us this whole time to keep reading the instructions for use and being respectful of the recommendations of the manufacturer. Well, I will tell you that this restoration extends well beyond the manufacturer's recommendations for this material. So I hope if nothing else you can say, all right, I can confidently use this for a class 2, a class 1, a class 5, etc., because I used it for well beyond that on a number of patients, and so far, so good. I'm going to knock on some wood here. There we go.